it's very easy to see that the best athletes tend to have the best performances, and they also tend to have the highest training loads. So it's really easy to draw a link between training load and performance. Higher training loads obviously leads to better performance. But if it was that easy, we'd all just train heaps and heaps and we'd be all great performers. What I'd like to do in this next vlog is talk you through how load and capacity interact with health to achieve great performances in athletes. This is a paper called Load, Capacity and Health, Critical Pieces of the Holistic Performance Puzzle. And I published this with Evert Verhagen in the British Journal of Sports Medicine. And what we presented was a schematic of how load capacity, health and performance interact. Now, when we think about load, it's really easy to say that if we increase load, our performance should improve. But we also need to consider that there's a number of different steps that are intermediary steps that lead to that improved performance. So initially, we need to load in order to improve capacity. We know that if we load slightly greater than our athlete's current capacity, then their capacity should improve. And if we throw excessive loads at our athletes, then it increases the risk of overuse injury, and it also increases the risk of poor performance. So it would be really easy to think, okay, well, in order to improve performance, all we need to do is load slightly greater than our athlete's current capacity. Capacity will improve and therefore performance will improve. Unfortunately, it's not that easy because we also need to consider an athlete's health, because transient increases or decreases in health can impact on our athlete's capacity, which means that the load that they can withstand on any given day changes from day to day based on health factors. Now, an example of this is if I used poor sleep. We know that sleep is a really important component of good health. If we have even one night of poor sleep, but if we have persistent poor sleep, then that will impact on our athlete's capacity, which in turn impacts on their ability to handle load on that given day. We know that long haul travel can have a similar effect where we have jet lag. We arrive in a location 24 hours after a long haul flight. We haven't lost capacity in terms of strength or aerobic fitness, but because of that transient reduction in health, for example, the jet lag or lack of sleep or stress, we have a transient reduction in capacity, which influences our ability to handle load on any given day. Now, it's also important to keep in mind that the load we apply, which is dependent on our athlete's capacity and dependent on their health at any given point in time, is very much context and environment dependent. So if you have a really important athlete and you're going into a really important game of the season, then the relevance or the relative importance of each of these factors might change. But equally, if you're a long way away from the start of your season, you're just starting the pre-season, you might be prepared to load a little bit more in order to improve capacity, get rapid changes in capacity, and you may not be as focused on the athlete's day-to-day health. Of course, it varies from team to team, but what I do know is that the best teams, the best performance and medical staff consider the load that they're applying to an athlete, and they consider this load relative to the athlete's capacity and also in consideration of that athlete's health, knowing full well that the load that an athlete can tolerate today may differ tomorrow based on day-to-day fluctuations in health. So hopefully you can see from this paper that in order to achieve great performances, it's not as simple as just loading more. We do need to load relative to our athlete's capacity, but we also need to consider their health on a day-to-day basis. And when we consider those three factors, load, capacity and health, it gives our athletes the best chance of achieving great performances.